So, let me share this a little bit with you. Some stuff we're going to fly through, some stuff we're going to spend some real time with. So, hold on, here it comes. Going once, going twice. There we go. All right. Don't worry, this is not going to be on a test. This is some old homework we used to give. But it does make a really good point. One of the ways that I navigate anatomy and medical stuff is by knowing prefixes and suffixes and roots of words. So, let me give you an example. If you look at number 19 on this list, it says path. Path tends to mean, oh, sorry. No, let me back up a second. I'm sorry. Let me back up a second. Look at number 12. Logi. Logi means study of, right? So, like biology is the study of life, of life. And so you will see this all over the place. And so just by remembering that suffix, anytime I see logi, I'm like, oh, this must be the study of. Or if you look at number 1, it says a or an or non. Believe it or not, in Latin medical terms, a means without. A means without. So when we say avascular, we mean without blood. Right? Avascular means without blood. What do you guys, by the way, there's a word bank over there. What do you suppose AB means? Ab.
Away.
Thank you. And add means?
To add to or bring to.
Yeah, bring to, yeah, back together. You guys should know what bi means. Bi means two. You've got your biceps brachii, the two-headed, seps means heads, the two-headed muscle on your brachial region, your arm. You've got a biceps femoris, the two-headed muscle in the femoral region in your hamstrings, yeah? Foramen. Does anybody know what a foramen is?
Opening or a hole.
It is an opening, a hole, yeah. You've got foramen all over the place. One of the really important places you have, you can't see, but it's at the base of your skull, and it's the foramen magnum. It's this big hole in the bottom of your skull that your spine goes up and connects with your brain. It's kind of important. Does anybody know what hyper means?
Too much.
Yes. Usually, by the way, that's 100% correct, but we usually term it as above, extra. So if you are hyperactive, you have too much energy. If you have hypertension, that's high blood pressure. What does hypo mean? Or infra? Or infer? Or sub? Those should all seem...
Underneath. Below.
What? Below. Yes. Below. So you'll often hear people say, I've got hypothyroid, you know, which is a low thyroid kind of condition, and it's very common. This one's really, really important. Itis.
Inflammation.
Yes. And you'll hear inflammation all the time. Itis, itis, itis. People come to you and they've got bursitis, inflammation of the bursae sacs, tendonitis, inflammation of the tendons, ligamentitis, inflammation of the ligaments, plantaritis, inflammation of the plantar fascia. It goes on and on and on and on. It's really helpful. I have people come in and tell me stuff I've never heard before, and it's got itis on the end, and I'm just like, oh, you know, you've got inflammation of this area. So some of this stuff's just kind of important. Let me point out one other one that is important too, which is 14. Myo. What does myo mean?
Muscle.
Yes! You guys are becoming myotherapists. A lot of people say myofascial work. What does that mean? I do muscle fascial work, myofascial therapy. That's how I look at myself, actually, as a myofascial therapist. Very, very cool. Cool. Let's let that go. That was just a little overview. I don't want to go too much into this, but I do want you guys to remember that your muscles are covered in fascia. Do you remember that? Each little strand, each little tiny strand is covered with fascia that's called endomysium. Then big groups of strands are covered with stuff called paramysium, and then epimysium goes around the whole thing. And what's really important here is your bone has fascia around it called periosteum. And look in this picture, this is important, how the fascia of the muscle weaves into the fascia of the bone. This is your tendon down here. Can somebody explain to me, if this is your tendon down here and it's fascia, why is this not your tendon up here? How do we define tendon? Think about it for a second. This is the same fascia down here. Why is this considered tendon, and up here it's endomysium, paramysium, and epimysium? And down here it's the tendon that weaves into the periosteum. Mr. Bigelow, you unmuted. Take it away, sir.
I was going to say because the bottom part connects to the bone.
That's true, and that is the definition of a tendon. Tendons attach muscle to bone. You're not wrong, sir. I think we can go even further, though.
I guess they're all in the same.
They are all the same. So what actually is true? What's the one thing that's different down here that's not different from up here?
Is it lack of muscle fiber?
Yes! 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 Why is that so profound? By the way, you were right, Mr. Bigelow. But what was so profound about what you just said was to recognize that really the tendon is just diffused through the whole muscle, and at the end the muscle disappears, and all you're left with is endomysium, paramysium, epimysium, and that's the thing that weaves into the periosteum. And it's a big graduation from when we guys first started, and by the way, every other massage school, I don't think anybody else could answer that question, another school, because most people think there's this tendon that's glued on the end of a muscle and glued onto a bone. That's not true at all. The tendon is prevalent everywhere. In fact, take it one step further. What's different about the periosteum than the tendon? Just take it further, Miss Smith. You're muted.
I know, because I'm saying that's hard. What's different?
Well, you just told me that the tendon was different here because of lack of muscle.
The fiber, right?
What's different about the periosteum than the tendon? What makes the periosteum the periosteum?
It's on a bone.
It's filled with bone.
It's filled with bone?
Mm-hmm.
Oh, that's confusing because I just think of like tissue.
Yeah.
Like spongy tissue.
What I'm trying to hint at here for everybody is, what if the endomysium, paramysium, and epimysium, and tendon and periosteum are all just fascia? And we name these different things because we stuff different portions of the fascia with different things. And there is no, I know the book makes a nice little separation here. It's got this jagged kind of thing here. That's not the way it is in your body. It weaves in. You can't tell where one begins. It's kind of like driving down a road when they change the name of it. You don't know really when you're going from one to the other. So this is all identical fascia stuffed with different things. So you guys are all fascial babies, and where your body needed rigidity, it filled that fascia with concrete. Where it needed contractility, it filled that fascia with contractile tissue, and where it just needed to hold stuff together, it just left that fascia alone. And so really what you are is a giant sweater of fascia. You are not a muscle attached to a bone via a tendon. You've got this fascia, and they filled this part with muscle, this part with bone, and connected them. They were connected already. Does that make sense?
So you're basically asking the same question. What makes the bone different from the tendon?
Yes.
the lack of bone.
Yes. Yes. And
And
vice versa. Yeah.
Vice versa.
Yeah.
Okay.
And I'm just trying to take your guys' education to a much, much higher level since you guys are becoming fasciologists. You study fascia. Is in the beginning we go, well, muscle contracts and muscle is attached to bone by this tendon. And bone has some fascia around it, but bone's this other thing. That's actually probably not true. When you guys were in the womb, you were probably all fascia, and then your body filled in portions. And by the way, the periosteum isn't just around the outside of the bone. There's fascia running through the bone. The bone's just filled in with concrete. There's no place there isn't fascia. It's just your body made some of the fascia very rigid by filling it with calcium and phosphorus and potassium, and it made some of it contractile by filling it full of stuff that can contract, and left some of it just alone. But really, you were fascia first, and it was filled in by this stuff. So you could define tendons a very different way. You could say tendons are absence of bone and muscle that happen to run between those two. And you could say muscle are fascia-filled contractile tissue, and bones are fascia-filled with rigid material. You could say that. Mr. McClure, sorry. You had your hand up for some time there.
Sorry for what?
You had your hand up for some time. I saw that your hand was up. No?
Oh, I was just going to say it's a question of density.
It is. That's a good way to put it, too. It's a question of density, too.
But Ms. Smith beat me to it.
Yeah. No, you both answered the thing really well. So anyway, just something to think about, that there really is no separation. It's not really like the muscle ends somewhere. And by the way, there's fascia running through the muscle and through the bone. It's really like a spider web that gets filled in. These aren't just sheaths even. So, stuff to think about. All right, that's all. Just want to make that point. It's a pretty important point. Miss Cuppage.
You know that we talked about it before, that the body something that is a traveling exhibition, basically, or
Body
exhibit.
World.
What? Body World.
Yeah, and they have a fascial thing now. Yeah.
Do they? Because I was gonna say, because they have,
I tried to get
amazing
pictures. I
stuff.
tried to get pictures for the class, and
Oh.
they wanted me to. The Fascial Institute wanted me to become a member, and it was like $1,500, and I was like, I'm not quite sure I want the pictures that bad, but yeah. So the Fascial Institute finally did this, and they got really cool pictures apparently, but I haven't seen them except very limited ones. I wanted to show them to you guys, but yes,
I've seen the show, and I've seen the exhibit, I should say, and it's amazing the things they isolated and how they really not just look at the body, but animals and all that stuff too. So I was like, hey, they didn't ever do myofascial. Like, I'm surprised they didn't do that, but now they have.
Now they have. I guess that was the trickiest one to do because it's kind of everywhere, and so how do you get everything else out of there?
How do you eliminate?
Yeah.
Yeah, I
Yeah.
would imagine that's genius.
Doing something like the circulatory system, believe it or not, is not as hard because you can inject the circulatory system with something and solidify it, then get it.
Yeah,
But-
plasticize it.
Yeah,
and
but then
eliminate
everything else
everything
is
else.
hard. Yeah, and so the fascial
Yeah.
system is really hard.
That's crazy.
And your fascial systems have nerves throughout it, everybody, and it can sense stretch and pressure and everything like that, which means it's also constantly communicating to your brain things like how far you're pushing your body, how fast you're moving, how far your joints are bending, your sense of being in space and time. Miss Smith.
I'm just wondering, how is the fascial system, like, how new is that to anatomy?
Thank you. Okay, so, really new. So, when I went to massage school, which I realized was like 28 years ago, but that's not that long ago in medical terms, right?
Right.
They didn't talk about this stuff at all. In fact, they actually taught us that, like, your femur stacks on top of your tibia, and you walk around, and there's a hinge there, and that's just how you do it. And what happened was, and that's true, by the way, your femur does go on top of your tibia. It wasn't they were lying to us. But what happened was sports physiologists later started to recognize that knees wouldn't last a week like that. That they really couldn't handle, even with all the padding and everything like that, they can't handle direct pounding. And they started to realize there's this fascial system that your bones are actually kind of floating in. And it uses this thing called tensegrity to kind of balance everything. And that's all in the last 20 years. And now it's...
So really, we don't know jack about fascia. Like, there's a whole world of research possible
Yes.
with this.
Yes, and
Yeah.
it's such a big deal
That's
now.
pretty exciting.
It's super exciting. I appreciate you putting it that way.
What?
Research? Does that make your brain
I
think,
know.
I could do that? I could do
I
research.
went to a research college for 3 years, so like
Oh,
my
yeah.
foundation of studying is research, and it just like makes
Well,
me a little bit giddy.
They have a national yearly worldwide fascial institute now that gets together and talks about this stuff. And it's doctors and massage therapists and physical therapists, and it's a really big deal now in sports
Right.
physiology.
This is like so important outside of
Yes,
massage,
Yes.
like just for the whole.
everything.
Yeah, that's just crazy.
It's super crazy. And it's super cool, you're right, because you guys are in a wide open field that's really changed recently. And I don't know of other schools that really, they'll talk about fashion now, but they're still not quite catching on yet. And so this is cutting edge. And by the way, this is not to put down modern medical science. This is just to point out to you all that you could discover stuff in the massage room. Modern medical science doesn't know jack. They still are figuring stuff out. Like, we still, by the way, to cure cancer, we chop off parts of people's bodies. Now, I'm not saying we shouldn't do that. I'm not saying it's not necessary, but that's the best idea we've got so far. Like, that's an idea a 4-year-old would come up with. And that's not putting down modern medical science. That's telling you that we are not as smart as we think we are. Even when we get like a vaccine or something, what are we doing? We're just taking the disease and a very small form of it and injecting it into ourselves. They did that in the Civil War, by the way. They didn't inject it in people. They'd actually take a little bit of ooze from somebody and scratch somebody else with it to protect them. It worked. But it's the same concept. We've just gotten better and sterile in controlling the amount. So I'm not saying we haven't done some amazing things, but there's so much further to go. Absolutely. We know very, very, very little. Very little. Yeah. And the fascia stuff is very little. And we don't know very much about
Get on it,
massage.
Jack Scott.
What?
Get on it. Let's
Get
go.
on it, yeah. Well, you guys are going to have to do that. I am launching you out in the world. Little research butterflies. Okay? You like that, research butterfly, huh? Yeah. Okay. All right. Okay, moving right along. Thank you, though, for pointing that out, Ms. Smith. It's really actually an important point to make. And there's several of you that have reached out to me in the class that are doing some really interesting stuff and thinking outside the box. So play around, screw around with your massage, try different stuff. We're doing a lot more than we think we're doing. And by the way, we haven't even touched on the emotional component. Please don't underestimate the emotional component of life, but massage in this case. Please don't. You will heal people's lives in the room by saying the right thing to them. And I don't mean like the clever little thing that figured out their problem they're having. I meant by helping them emotionally heal. By being kind to your clients. You will change people's lives. That is not me just pumping that up. You will change their lives. I've had clients come back and be like, that thing you said changed everything. Everything. I didn't realize I didn't have to feel bad about that. I didn't realize this thing. You know what I mean? Thank you for your kindness. Just you listening and repeating back what I said. That's what I do to a lot of clients. I just mirror back to them. Oh, so you're saying da-da-da. Just that alone. Very, very helpful. Very helpful. Okay. Contraindications. Contraindications mean reasons reasons massage might not be indicated. Reasons you might not want to do massage. This is an important thing to know. This is something you should know, but if you don't, we're reviewing to catch you up. But if somebody comes in and says, the doctor said this is contraindicated in this area, you need to listen to them. What they're telling you is the doctor saying don't work this area. And when it is just an area, we call it a local contraindication, right? If I stuck my hand into a deep fryer and my hand's burned, but it's all wrapped up, I might come in and say, I feel fine. You can still do the massage, but my hand is a local contraindication. And it's important you know that means don't touch my hand. Yep. Get a sunburn on my back. I can still get a massage, but maybe the sunburn on my back is a local contraindication. I have an oozing wound on my leg. I can still probably get massage if I'm not running a fever or anything like that, and we kind of know what it is. But the open wound is always a contraindication. Okay? For lots of reasons. Because it's an open wound to the client, but also you don't ever want to touch a break in the skin. If your skin is unbroken and the client's skin is unbroken, it's almost impossible for you to get anything. But if their skin is broken, that changes all that. That's a local contraindication. A general or absolute contraindication is the same thing. I prefer absolute because it means absolutely don't do it, but some people call it a general contraindication because they mean the general, the whole body. General contraindications mean don't do the massage. Those tend to come about when there is something systematically wrong with the person. So when I burn my hand, it's not affecting the rest of my body. My body, I can go out and run a marathon. Just got to have my hand wrapped up. Systematic stuff is like, I'm going through chemotherapy. Sure, the chemotherapy is for this problem in my shoulder or whatever like that, but my whole body has chemicals running through it. I'm running a high fever. That is an entire systematic problem. No matter where you rub me, that's going to be a problem. That is a general or absolute contraindication. Yeah? Relative contraindication means proceed with caution. Everybody's a relative contraindication as far as I'm concerned. That's not how they use the term, right? We would say things like pregnancy is a relative contraindication. Of course they can get a massage, just proceed with caution. But I mean everybody's a relative contraindication. Everybody's got something that I should take into consideration. Miss Zwick.
So I can kind of see why pain medication would be a contraindication, but why is it a do not massage at all contraindication?
Really good question. Okay. So, by the way, I'm really glad you asked this question because we're entering into a very gray area. So, the fear about pain medication is that the person no longer can give you accurate feedback about how deep to go. So, the fear is that, because that's a pretty good feedback system, in general, when the massage feels good to the client, you're fine. I mean, that works 99.9% of the time. But if they're all hopped up on pain meds, that you might be going deep and they're like, it's fine, but it's not fine. That's why they say that in the book. I will tell you.
But that would be only for like a deep tissue.
Right.
Not like a Swedish massage.
Right. So let's suppose I go over to my regular, I'll tell you what Tapscott would do because I would not cancel the massage for that reason, me personally. Let's say you go over to the client's house and they're like, oh yeah, I hurt my shoulder and I'm kind of hopped up on pain meds, Mike. And I'd be like, okay, but we can still do like gentler massage, reflexology, you know, there's all sorts of things. I'm still going to rub their head and neck. I don't like turning people down for massage unless I think I'm going to endanger them. So I would proceed with a relative contraindication, but your textbook will tell you no, no, no. Textbooks will also tell you you should never ever massage somebody under the influence of alcohol. The old textbooks used to say marijuana. And I got to tell you that I would have lost half my clients if I didn't massage people that were under the influence of alcohol and pot, because when I go over to the house, of course they've had a glass of wine. You know, of course they're a little high. That's why they want me to come to their house and massage them. And it's fine. It's fine. I only worry about somebody when they're drunk and they're stumbling around because they could hurt themselves. If somebody's had a glass or two of wine, I don't care. It doesn't matter. It really doesn't. So you got to use your common sense with this stuff. Good question. Thank you. Miss Smith.
Just really quick, I wanted to touch on a complete contraindication with people who are cancer patients who are on chemo.
Yeah.
That is honestly a lot more for your safety than them. When I worked at the hospital, you had to flush the toilet twice after they went to the bathroom. We had to double glove just to take their vitals. So I know a lot of times, especially with cancer patients, you know, you want to feel for them and be like, oh, it's fine. But a lot of times things that can harm us are things we can't see. So it doesn't have to be just like an open wound, you know, on their arm.
What are you worried about contracting from the cancer patient?
A lot of times the medications that they're on can harm you just by touching
Oh! All right, I never thought about that. By the way, my thing with, thank you, by the way. I've never actually thought about that. With cancer patients that are on chemo, I always just ask for a doctor's release.
Right, so I was just saying, like, be very...
But that's a really good
take that
point.
seriously when a doctor says, like, do not massage.
Oh, and by the way, even me, Mr. Wild Wild West here, I want to be very clear to all of you. If a doctor says don't massage, I'm not looking forward to going to jail in a lawsuit. I don't massage. Right. Like I don't massage. And I've had people come to me in those conditions before, and I'm like, I need a doctor's release for this. And I'm not one that normally asks for that kind of thing. So anyway, yeah. And if a doctor says no, it's no. You just don't want to deal with that. You can't handle it. Okay. Boom. Here we go. I'm going to be calling on some people here. Let's see if we can name regions of the body. Do you guys remember regions of the body? Yeah, you do. Sure. Let's just go through our little listy. So, I see people flying through books right now. Miss Zwick, what is number 1?
Well, that's the head.
It is the head. She's exactly right.
Let's see. Sorry.
It's
these-
specifically the back of the head they're talking about, not the entire head.
Okay.
Do you want a clue? Like the first letter?
Yes.
Okay, it starts with a C.
Ooh, it's not. Oh, cranial.
It is cranial. Yes, very, very good. You could have guessed something else, but that was the correct answer. That's your cranial region, right? Cool. Miss Vega, what's number 2?
The cervical?
It is the cervical. Thank you. Mr. Shakali, what's number 3? This one's a little tricky. But I can give you a clue, too, if you want it. Mr. Shakali? Oh, there you are.
I'm here.
Cool.
I'll take that clue.
Okay, you got it, buddy. It starts with an A.
The acromial.
Mm-hmm. It is the acromion. Well done, sir. I like what he did there. So that's the acromion process. Remember that? It's the edge of your scapula. It's that shoulder pad there. Awesome. Well done. Thank you. Mr. Bigelow, what's number 4?
I was sitting there saying, calling me.
Good.
It's the scapular.
It is the scapular region, because that's the scapula there. I love it. Thank you. This one's a little tricky. Miss Cuppage, what is that region? Number 5.
I would like to say, I'd like to buy a vowel.
It's associated with ribs.
Thoracic.
Thank you. Well done. I love that. Thank you. Miss Tisket. This is kind of tricky because we haven't done this in a while, Miss Tisket. I'm happy to help. But what region is number 6? Number 6. What?
Number 6 is lumbar.
Yeah! Phew! Knocks out of the park. Brilliant in several languages. I love it.
Can I ask a question?
Yes.
Isn't 3 the deltoid region?
No, by the way. No, it's here. By the way, I mean, you can make all sorts of arguments, but let me put it this way to you. No, take them all. Take all the bags.
Oh, they need packed.
They're not packed?
No, of course.
No, they're all packed. They're all packed, sir.
They're packed.
Yeah, they're all packed. So let me, Miss Cuppage, what is the origin and insertion for your deltoid?
The origin is your
It's
your clavicle, your acromion.
yeah.
Yeah.
Keep going.
AC joint.
So
Your
I feel like you're definitely in the right area, by the way. So it is the lateral 1/3 of your clavicle, which then turns into your acromion process, and then goes in the spine of the scapula.
Yeah.
So that arrow is pointing to the acromion process, so the deltoid region would have to be below it, because the deltoid goes down and inserts in your arm. Does that make sense?
Okay.
So
Yeah,
I
they don't really have
they don't have a good example here on
they
the
don't have an arrow pointing to the deltoid region,
No.
right?
no.
Okay.
A good arrow would have been. Let me make sure you can see a good arrow would have been right here at this hump here, right?
Okay.
That would have.
Okay.
That's the deltoid region. Anyway, I
All
love
right.
the question. You're definitely in the close. The acromion process is at the superior border of the deltoid region.
I see that. I just was like looking at my notes and I was like, well, where's the deltoid region?
Yeah,
Did we
yeah,
miss
yeah.
that?
Yeah,
Okay.
you got it.
I forgot there were so many regions, to be honest.
There are. That's part of the reason we're doing this review, right? It's just to kind of make our way through there. After we're done with the slide, by the way, we'll take a break, everybody. Miss Stewart, what is number 7?
Sacral.
It is. Thank you. Miss Dowler, what is number 8? There's several answers that I think I would accept there. I was just realizing.
I wouldn't say gluteal, but I think that's number 14.
Yeah, by the way, that's why I would have accepted gluteal, but you're right. Number 14 should be gluteal. So I'm thinking, do they have like oh, you know what they mean? I think they want to refer to this as the hip. Or the starts with a P.
Coxal region?
Coxal region would actually be between the two gluteal regions. I'm assuming this is pelvic. I'm assuming they're trying to tell you this is the pelvis.
Okay.
I'm with you on that one. And the fact that you knew all those differentiations is more important than what the exact right answer is, if that makes sense. Thank you. Miss Smith, what is number 9?
Number what? Sorry.
9.
Cyril. Cyril.
Yeah, it is Searle. I had to think for a second. That's how little I use that. It's Searle. Yep, that's right. The back of your calf is called the Searle region. Well done. Miss Flores, what is number 10? You might need a clue.
Is it the cephalic?
Miss Flores, it is the cephalic all day long. Bam! No clue for you. Good job.
Thank you.
I have another question.
Yes, Miss Gumpich, please.
Is the sacral region considered the upper or the lower
It's
extremities?
Oh, that is a really good question. It's considered the lower extremities because your sacrum is actually considered to be part of your hips.
Okay.
But these are just terms that we've come up with, right? I often think of it as part of the spine, and I don't really think of it that way. But yes, the sacrum is considered to be part of your hips. And if you kind of look at it, your hips kind of roll through the sacrum. The sacrum is crucial to your pelvis. So usually the sacrum is thought of as part of the lower body. Yeah. Miss Tops, what's number 11?
Carpal?
Yes, carpal. That is your wrist, your carpals. Carpals. Okay, this is tricky. Miss Juntapone, number 12. If 11 was your carpals, what are the bones that are up from your carpals? This area here. Oh, they may not have that. Sorry.
Dorsal.
Yeah, it is dorsal. She's right, and I was giving a clue to the wrong answer. These are your metacarpals up here, but that's not what they meant. They meant dorsal. Dorsal means back, by the way, and there's several regions in your body that are called dorsal. The back of your hand, the top of your feet, and your back. They're all referred to as dorsal regions. Very, very good. Really, really good. Thank you. Mr. Kachekian, what's 13?
It looks like digital.
It is. It's digital.
It is?
Yep. Yep. And that happens to be proximal phalange number 3 is what it looks like, but they want digital. You're 100% right. Good job, sir.
Okay. Thank you.
Really good job. Okay. What? Miss Ratana, what is number 14? Somebody said it already, very helpfully.
Good.
What'd you say?
Good. Gluteal.
Yes, gluteal. Really well done. Thank you. Really well done. Miss Miss Kilpatrick, what is number 15? The back of the knee pit.
The back of the knee?
Yes. Little pop quiz here for you.
I know the front of me.
Yes, you do, because every gal and fella has a patella. But this little pop quiz for you on what the back of the knee is called. Starts with a P. Little pop quiz. Starts with a P. Back of the knee.
know popliteal.
Yeah, popliteal. Very good. Thank you. Thank you. Nicely done. Mr. Nochin, what is this? Number 16. Yep.
That would be
The what? I just didn't hear you if you said it.
I'm looking for it on the list.
Yeah. It's on the upper body of the woman on the picture, 16. What do you call that chest region?
The thoracic?
It is in the thoracic region, so I love that. He is 100% right. Technically speaking, that's the thoracic region. This is a region within the thoracic region. You probably work on this region when you're in the gym.
The pec region?
Yes, it's called the pectoral region. Good job. Thank you, sir. Miss Langford, what's 17?
That looks like the axillary.
It is the axillary region. Thank you so much, ma'am. Miss Ramirez, what is 18? It's another word for arm. Miss Ramirez, 18. You know what?
Brachial.
What?
Brachial.
Yeah,
Brachial.
you're 100% right, ma'am. Just say it again, because you said it perfect.
Brachial.
Brachial. It's a brachial region. You don't want to break your brachial. Nicely done. Miss Lopez Moreno, what's 19?
19 is the cubital.
Beautifully done. Cubital. Nicely done. Thank you. Mr. McClure, what's 20?
Abdominal?
Abdominal, yes, sir. Awesome. Miss Magruder, this one's kind of tough because I don't know how much we talk about it. What's 21?
It is tough because I cannot pronounce it.
Do you know what it starts with? What letter?
I.
Yes, that's the inguinal region.
Huh?
Inguinal.
Inguinal?
Yeah. Inguinal. Inguinal region. Say it one more time, and I'll leave you alone.
Inguinal?
Yes, thank you. We care about it, everybody, because it kind of is you don't work below the inguinal line.
Is that like the waist?
It is kind of like the waist from your hip bone, kind of over to your pubic bone, really. They call it the inguinal line. Yeah. Well done. That's really good. Thank you. Thank you. Miss Mitchell, what's 22?
Like the pubic.
It's the pubic region, exactly. It's where your two pelvic bones come together, by the way. Thank you. Mr. Penrod, what's 23?
Femoral?
Femoral region, yes. That would be true front, back, side. It's your thigh. Femoral region, really well done. I love it. Thank you. Mr. Nochin, what is 24?
Dorsal?
But it's the bottom. It's the bottom, not the top.
Plantar.
What?
Plantar.
Plantar region. Really nicely done. Thanks, sir. Mr. Arshakali, what is 25? I have to look at what 25 is. Oh. Don't overthink it, sir.
Isn't that the cephalic?
It is the, no, sir, you're not wrong. It's the cephalic region, the whole head is. I think they want us to say facial.
Oh.
I'm not thrilled with it either. I'm glad you knew cephalic. Thank you. Well done. Very well done. Mr. Bigelow, what's 26?
Mandibular.
Mandibular. It's your jaw, everybody. Your jaw region is your mandibular. Really well done. Miss Cuppage, that's kind of a challenging one. What is this region that is above your clavicle? 27. He said, giving a huge, huge hint. What do we call the region above your clavicle? If we only had a name for above your clavicle, what would we do? Do we have a word that means above? Do we have a word that means collarbone? Could we put those together? I don't know. Miss Cuppage, you're muted, by the way.
Supraclavicular.
Yes. She just said above clavicle. Yeah.
So, yeah, we didn't get all that.
But you know the word for above, and you know clavicle.
True.
Yeah. And you put them together. That's even better. Thank you, ma'am. Miss Dowler, what is 28?
Anticubital.
Antecubital, everybody. Your cubital is your elbow. Antecubital is the opposite of your elbow. So your elbow pit is called your antecubital. Nicely done. Miss Flores, what's 29? Bum, bum, bum. Starts with a P.
Yeah. Palomar?
Palmar. Yeah, nicely done. Thank you, ma'am. Miss Tops, what's 30? Yeah, thank you. Every gallant fella has a patella. Miss Juntapone, what's 31?
Kuro?
31? What'd you say?
Kuro.
Cruel. She's right. It's cruel to get kicked in your curl. Really well done. And last but not least, Mr. Kachekian, what is 32? Besides a foot. It's the top of the foot they want to know.
Top of the foot.
I know, this is very deceptive. But the top of the foot is like the back of the hand. So they name them the same. I know.
It's not dorsal.
It's not? Because that would be my guess.
Oh, it's dorsal.
It is dorsal, sir. Awesome.
Sorry.
All right, don't be sorry. It was great.
That's the only one that made sense, but I wasn't sure.
No. And things are moving along. And we just covered the regions of the body. And I'm so happy. Yeah. Cool. I'm not going to worry about this. Oh, I am going to worry about this. Yeah. So, do you guys remember the planes? Right? Now, I don't mean airplanes. I mean planes that divide my body from top to bottom, left to right, front to back. Yeah. Good. Okay. Well, let's see. We were just flying on down here. Miss Langford, what plane do you suppose number 1 is that's like a tabletop in this picture? In this case, it's dividing this person from top to bottom, he said.
I will say the transverse.
You will say it, and you will be correct, madam. That is the transverse plane. It doesn't have to go through your waist, everybody. It can go through your shoulders, whatever. We use it to usually check balance. Like if I came in to talk to you guys and I was like this, you'd be like, his shoulders are not even in the transverse plane. When we put a plane through it, one shoulder's in the plane, the other shoulder's out of the plane. So the transverse plane could chop you any way at once, but it's top to bottom. Love that, love that, love that. Miss Lopez Moreno, what is number 2? What plane is that divides me from side to side?
Side to side would be sagittal.
Yes, it would be. Side to side would be sagittal. That particular one happens to be a mid-sagittal plane. It's right in the center. You don't have to have a mid-sagittal plane. It can be going side to side over here. It doesn't have to be even. We normally look at mid-sagittal. We want to know if somebody's even within this plane, if they're aligned up and down. Somebody who has scoliosis, their spine does not line up in the sagittal plane. Whereas people without scoliosis, their spine is straight up and down in the sagittal plane. It curves, but it curves in and out. Very well done. Thank you. Mr. McClure, what is number 3 that's coming through the side of this person's body, dividing them from front to back?
Frontal.
Frontal. And we look at frontal planes a lot, by the way, guys, because we care when somebody's standing here where their head is it lined up over their feet, all that kind of stuff. Yeah? And we know for a fact, that people tend to change their front and back structure based on stuff they're trying to offset in their body. There's this guy in my gym who's very, very, very overweight, and he walks like this because he has so much stomach in front. That's how he has to balance his body. So I'm not making fun of him. I'm just saying that's him trying to balance stuff, to try to get some balance over his feet. Who just raised their hand? Who did I just miss? Oh, yeah. Miss Tops. Should have known.
Okay, but it's okay. It was just really something for myself because it's kind of confused me a little bit, and you just really gave me clarity. So I'm going to think of the transverse as the T. The top of the T is slicing it.
Oh, I love that.
So it's slicing your body, and then the sagittal, I'm going to think of side to side for the S's.
That's why I did that,
And then the last one is, of course, frontal, and then front to back.
Yeah.
So, thank you for that. I appreciate it.
You're very welcome. And what I've always found transverse to be at the top of the T, which I love, to be used in massages to check shoulders and hips. Because, people's hips can be, one leg could be longer than the other or whatever. And so that's usually when we talk about transverse plane. The frontal is when we're checking, like, if they're over their feet. Those are just common ways I've seen those used. All right, I'm not going to worry about anything else here. Okay. Do you guys remember about distal and proximal? Distal means distance. Now, my wrist is distal from my elbow, right? All I'm saying is my wrist is more distant from my elbow. That doesn't mean my wrist is always distal. My wrist is proximal to my fingers. It is closer to me than my fingers are. It is in closer proximity. So I don't want you to think that certain things on your body are distal or proximal. We're always talking about it in relation to something else. Usually we're talking about stroking somebody. I am stroking myself distally as I go down towards my fingers. I am stroking myself proximally as I come up to my body. Yeah? Distal and proximal. Those are terms that are used all the time in massage therapy. They use it. They don't wait for you to figure out what they're talking about. Distal and proximal are used all the time, just like lateral and medial. Lateral means away from the midline. Medial is towards the midline. Medial does not mean middle. It means heading back towards the middle of the body. But it doesn't mean middle. It just means heading that way usually. So those are used all the time. This is an old test that I used to use, I think with my high school students actually. And that's why it has attendance, attitude, and anatomy. We used to call them the 3 A's. Because that's the key to success in the massage classes. Attendance, knowing your anatomy and having a good attitude. By the way, that's the key to life, right there. So, just in case you wanted the key to life. A lot of people are looking for it. I thought I'd give it to you for free today. 3 A's, yeah. Think about it. Most things in life don't go well when you stop attending to them. You'd be surprised just what you show people just by showing up on time. They're like, oh, you care and I could trust you. And then you show up with a good attitude on time. Woo! Yeah. Cool. Clinical tidbit. Love it. Okay! We've got actions. I know you guys love actions. Yes. Miss Magruder, what action is this person performing in number 1? I like the music. They're doing a sit-up. So, they're moving forward.
Is it? Oh, flexion.
Yes, good job. Thank you. Miss Mitchell, what is this person doing in number 2?
Extension.
Yes. Mr. Penrod, what's this person doing in number 3?
Rotation.
Yes. Miss Ramirez, what's this person doing in number 4? Miss Ramirez? Miss Ramirez? You're still muted and I can't see you. Oh, nice of you to join us today.
Hi.
Hi.
Sorry, my dog was locked in the room.
Yeah?
Yes.
You're going to be in the doghouse. Answer this question. What's number 4? That's a joke, by the way. What's number 4? What is that person doing there? Bending to the side. Some people would call that bending laterally. What do we call when we bend laterally?
Lateral flexion.
Yes, ma'am. Thank you, thank you. Miss Ratana, what's this person doing in number 5?
Flexion.
It is flexion. Thank you. Miss Smith, what's this person doing in number 6?
Extension.
That's right. Miss Stewart, what's this person doing in number 7?
Rotation.
Yes, ma'am. And Miss Tisket, what's this person doing in number 8?
Lateral flexion.
Lateral flexion. Well done. All right. Miss. Wow. Miss Vega, what are the ribs doing here in number 9, 10, and 11?
They're elevating.
Yes, they are elevating.
And expanding.
Oh wait, see, that was awesome. I wasn't expecting all that. Wait, they are elevating and they are doing what?
They're expanding during inhalation.
Inhalation. She's 100% right, by the way, everybody. That was just more than I even wanted, but I'm really glad she said it. They are elevating. They are elevating because your ribs, you guys can all do this right now. If you breathe in, your ribs come up and they expand, and that's when you're inhaling. Inhalations cause an elevation and expansion of your ribs, which means on the other one, when you breathe out, they depress, they contract, they collapse, and you exhale. And you use force usually to breathe in. You usually just let go at the end to breathe out, unless you're running. Nice, really well done. Thank you, Miss Megan. Way to knock it out of the park. Miss Sawick, what is number 15 doing as the scapulas move superiorly?
Elevation?
Yes, elevation of the scapula. Very well done. Mr. Shockley, what is happening to the scapulas here as they move medially? 16.
I want to say adduction.
I want you to say adduction. Thank you. Adduction. Really nicely done. Mr. Bigelow, what's happening with 17?
Abduction.
Abduction. They're moving away. That's how you get the extra punch power. It's not just coming from the elbow and the shoulder. You're getting abduction or a protraction of the scapula to give it that extra final rocky pow. Awesome. Miss Cuppage, what's happening in 18 as the scapulas go down? It's interesting for this person to go up. The scapulas have to go down.
Depression.
Yes, that's exactly right. Thank you, thank you, thank you. Miss Dowler, what's happening in 19 as the scapula rotates? The question is, what kind of rotation?
Upward.
It is upward. We measure rotation from the acromion process, and this is the acromion process right here, and it's going up. So, Miss Dowler, what would this rotation be, the number 20?
Downward.
Downward rotation if the acromion process goes down. We do this because talking about rotations is really difficult because something's always going up and down. So we just decided to pick the acromion process. Really well done. I appreciate it. Thank you. Ms. Flores, what is the action that's happening as this person lifts their arm up in 21. Lifts the shoulder up in 21. Up in front of them. Ms. Flores?
Is it flexion?
It is flexion. It's in front and it's flexion. Really nicely done. That's not always true, but that's a good way to kind of remember. Ms. Tops, what's happening in 22?
Extension.
Extension, yes. And everybody remember, it doesn't have to be behind me to be an extension. It's just moving to behind me. I can have my arm out in front of me, and right now, I'm not doing anything. The minute I start going down towards the back, it's an extension. The minute I start going up, it's a flexion. Really nicely done. Thank you, thank you. Ms. Juntapone, what's going on in number 23 as this person tries to put their arms back to the side of their body?
Abduction.
Adduction. Awesome. Mr. Kachekian, what is this person doing in 24 as they try to take their arms away from the side of their body?
Abduction.
Abduction, which happens to mean away. Excellent, excellent, excellent. Miss Kilpatrick, what is this person doing here in 25 as they move their arm horizontally?
Horizontal, that's going away, right? When it's going towards the body.
Did you just say is towards away? Think about what you just asked.
No. I'm asking the question. The 25, he twisting?
25, he is bringing his hands together like this. Well, he's bringing one hand together.
Adduction.
Well, beautiful. Adduction. I love it. Thank you. Thank you, thank you, thank you. Mr. Nochin, what's 26? It's actually a rotation.
Medial rotation.
It is medial rotation. Thank you very much. That's really important. And by the way, guys, that's a very common test question. And oftentimes the person has a bent elbow like that to show you the motion, but the motion isn't about the elbow. So it really throws people off. And if you get to the end of the year and you take the final and this happens to be on it, which I'm sure it won't be because I'm making a really big deal about it and I've been talking about it for 2 minutes now, so I'm sure that will never happen, and you call me over to your desk and you say, is this about the elbow or the shoulder? I'm literally going to look at you and be like, I'm not answering that question. And that's the truth. I'll be like, I discussed it. The motion is about what's happening at the person's shoulder to make this happen. They just have their elbow bent to show you movement. But this person is doing a medial rotation in number 26. Yes. Thank you, thank you, thank you, sir. Miss Langford, that means number, I know I'm skipping one, but Miss Langford, that means number 28 is a what?
Lateral rotation.
Beautiful. Thank you, ma'am. Couldn't have said it better myself. Really well done. Okay. Miss Lopez Moreno, what's going on in 29?
Flexion of the elbow?
Yes. Do you happen to know, she's 100% right, but to give it a little extra twist, do you happen to know what the elbow joint is called? It's where the
shoulder.
Yeah, the shoulders. This is where the humerus meets the ulna.
Yeah. Is it humeral ulnar joint?
Yes, 100%. Yeah. Just like if I was like, meet me at Bell and 29th Avenue, we call that intersection that because those two things meet there. That's called the humeral ulnar joint. That's what we call our elbow. Really well done. Thank you so much. Mr. McClure, what is this person doing as they are able to move their hand down because their humeral ulnar joint is heading down?
Extension.
Extension. Thank you so much. Extension of the what? What was that joint called, sir?
The humeral ulnar joint.
Yes. Awesome. Thank you. Thank you.
Mouthful.
It is. Miss Magruder. What's going on in 30? What's going on in 31? Is this person flips their hand over to turn a doorknob?
He is, you said flip pronation on the forearm?
So if I flip my hand over, what's it going to look like at the end?
Oh no, supine. It's
Yep.
like a bowl.
Yep.
Supination.
And by the way, you guys are all, everybody in this class is a stronger supinator than they are a pronator. which is why screws and everything are designed to be turned clockwise, because you're stronger at supinating. That's not an accident that doorknobs turn this way and all that kind of stuff. Well done, thank you. Miss Mitchell, then what is 32?
Pronation.
Yeah. Yes. Does anybody have an idea of what joint is? We haven't talked about this yet. You're going to learn about this in the next class, actually. Anybody have any idea what joint is allowing you to supinate or pronate? Because it's not the humeral ulnar joint. Your elbow doesn't rotate.
Something to do with the metacarpals.
Doesn't have anything to do with metacarpals. Those are in your hand.
Oh,
And it's not your
carpal.
and not your carpals, believe it or not. They can't rotate. They can flex, extend.
Radial ulnar joint.
Yeah, what did you just say?
A radial ulnar joint?
Yes, everybody, we have two bones in our body. We've got lots of bones in our body. We have two bones in our forearm. the ulna and the radius. And this is hard to imagine, but it's 100% true. Right now, let me get back here. They're one's running up here and one's running up here. When I flip, they cross over each other. They literally do this. If this is my ulna and this is my radius, when I rotate my wrist, they do this. So, right now with my hand here, this is my ulna down here, this is my ulna up here. Ulna. When I turn my hand over, ulna, radius. The radius actually rolls over the ulna. You have a proximal and a distal radial ulnar joint. Don't worry, we're going to study this later, but I just know you guys are hungry for knowledge. And I just want to keep you fed. Yeah. All right. Really nicely done. Good job, Miss Covich. Okay. Mr. Penrod, what is this person doing in 33?
Flexion of the wrist.
Yeah, flexion of the wrist or the carpals. I like it. Mr. Ramirez, what's this person doing in 34? Which is the opposite of 33.
Extension.
Extension. Say it again like you mean it.
Extension.
Good job. Thank you, ma'am. That's beautifully done. This one is a little tricky. Miss Ratana, do you have any idea what's going on in 35? It's actually AD, adduction. Yeah. Everybody, this is really tricky, so let me just show you. You have to imagine a person in anatomical position. And if I bend my hands to the side in anatomical position, they are getting closer to my body. That's adduction. And if I bend them away, that's abduction. But here's the tricky part. I'm still doing adduction because I just turned my wrist around, and you have to imagine me back in anatomical position. We're always rotating our client back in anatomical position. Because I can do funky stuff with my hands up here above my head, you don't know. You have to put me back in anatomical position. Miss Smith, please. You have a question, but you are muted. Miss Smith. Do you know you have a question? Do you know that you're muted? Do you know, Miss Smith, can you hear me? No? You also went blank? Can you guys hear me? Okay, good.
Yes.
Good, okay. Miss Smith, come back to me. All right. Where was I? Oh, there you are, Miss Smith. Hi.
My internet went out literally right as I
asked your question. Okay.
I'm so sorry.
So don't be sorry. What's your question?
Could you go to the previous slide?
Yes, ma'am.
So I'm just confused about 35 and 36, and everyone else just plug your ears so I don't confuse any of you more. Why is that not lateral flexion?
Okay.
when leaning to the side like this is.
Oh! Because it could be. Because it could be. Like, some people just decided how to name this stuff. That's not crazy what you're asking. At all. At all.
So that wouldn't be wrong?
It would be wrong because nobody uses that term.
Ugh.
Right?
Okay.
But you're right. I understand what you're saying. Also, but you're right. I mean, you could say the abduction is a lateral flexion, I guess. Yeah. It's just not
Because,
normally used that way.
I don't know.
Yeah.
It's like kind of confused.
It is. But what's more
The
confusing,
fingers in the hand just confuse me.
they confuse me too. What's even worse is you have to picture my hand here. So right now my hand is abducting out here. But when I bring it up, it looks like it's adducting, but it's not. You have to imagine my hand down here.
Right.
So all I can tell you is put people in an anatomical position, and you just have to remember this one. And by the way, you notice that some people call that ulnar deviation or radial deviation, which means moving towards the ulnar or the radius, which I like better. Why do I like it better? I don't have to put you in an anatomical position. I know this is radial deviation, you're going towards the radius. I know this is ulnar deviation, you're going towards the ulnar. I prefer that, actually. Yeah.
Okay.
Anyway, I love questions like that because it means you're thinking. In fact, I don't even care if they're right or wrong. It shows a conceptual understanding of the material, and I promise you guys, conceptual understandings will get you further in life, especially if you're trying to discover new things than just memorizing stuff. You're just regurgitating what somebody's done before, and they're not always right even. Okay, moving right along. Let me share again. Boom, boom, boom. You guys are doing great. Got another break coming up. Hang in there. Miss Smith, actually, what is going on in 46? Miss Smith?
Elevation and
Yes. Yes.
Yeah.
Elevation is number 46. Yeah. Got it? If I tell you to elevate your temporal mandibular joint, that's your jaw joint, I'm very nicely saying to shut your mouth. Cool. Not that I would ever do that. Okay. So that means 47 is what, Miss Smith, just since I have you there?
Depression.
Depression, yes. Miss Stewart, what is 48 and 49? They're two different answers, but this person's jetting their jaw out or pulling it back.
Protraction and retraction.
Yes, I wanted to demonstrate for you guys, but I'm not really good at it. But people can have their jaw protracted and retracted, and believe it or not, you all do it a little bit when you chew. Your jaws don't just work like a hinge. Your bottom jaw actually comes out and back in a little bit when you chew. We will learn about that. Which makes number 50, Miss Smith, you might like number 50 because it kind of follows probably what you would call it. What do you think number 50 is, Miss Smith? Not to run this to the
I
ground.
actually just saw it in the book before you talked about it, and I laughed a little bit.
Yeah.
But lateral
Deviation, yeah. I always have some student who can do it really good and move their jaw. They care about my wife is a dental assistant. She works for the VA, and they talk about lateral deviation all the time. They care a lot about it because your teeth don't match up when you have lateral deviation. Cool, awesome. Ms. Tisket, what kind of rotation of the or tilt of the pelvis is this? It's a tilt. What's this tilt? The bottom's moving back. What?
Anterior.
Anterior tilt. Why did she not say posterior tilt, everybody? I mean, she's right, by the way. You are right, ma'am. We measure tilt from the top. Anterior tilt is the top going forward, which makes your butt go backwards. When you see somebody and their butt sticking out way in back, they actually have an anterior tilt. When you see somebody and their butt is disappearing, Miss Vega, what type of tilt do they have when their butt disappears?
anterior tilt.
Well, anterior is front. You look at the top here, and the top's going back, so it's a posterior tilt. Posterior tilt makes your butt go away. Also, look what it does to the spine here. Look how the spine straightens out. Posterior tilts are not as common, but they're not good because you lose curvature of the spine. Anterior tilts, you get exaggerated curvature of the spine. Miss Sawick, what is number 53?
Lateral tilt.
Lateral tilt, yeah. And what can it do to the spine? You can kind of see it in this picture. What does the spine do when the one side of the hip goes up, the sacrum is no longer even? Miss Sawick.
I think she froze.
I know, I was just giving her a second. I think she froze too, but I was curious her answer. I was willing to give it a second. Miss Sawick, what kind of curvature of the spine can an elevated hip cause? Okay. Anybody?
Would it be the same as the jaw, the lateral deviation?
Yeah, but what do you call when the spine has to go from side to
Scoliosis?
side? Scoliosis. Yeah. Scoliosis is what you have. Because you push part of the hip over this way, so now the spine's got to go back the other way. It's got an S-curve from side to side, which is scoliosis. So anterior tilts tend to exaggerate the curves of my spine as I try to get my head over. Posterior tilts tend to make me have a straight spine. Lateral elevations or lateral tilts tend to make my spine curve left to right, right to left, to try to get my head back over my feet. Your body's always trying to get your head over your feet, or the main mass of your body over your feet. Yeah, cool, cool, cool. Okay, Mr. Arshakali, what is number 54? And by the way, this is really important, everybody, just so you guys know, and Mr. Arshakali knows, everybody here though, this red dot that you see, hold on, right there on the hip, is telling you that's the joint they're talking about. They're not talking about this knee. They're talking about the hip here, so the entire leg going up like this. What do we call this when the person's hip goes up like this? They're not talking about the knee. Mr. Arshakali?
Flexion?
Yes, thank you, sir. Flexion. Well done. Awesome. Mr. Bigelow, what's 55?
Abduction?
Yes, really well done. Miss Cuppage, what's 56?
That is medial rotation.
Yes, she's 100% right. Medial rotation, which is often called internal rotation, not by me, but many people do. It is a medial rotation. Isn't it interesting? What happens to the foot when the leg's bent like that? What happens to the foot when the hip medially rotates? The foot
reverts.
Well, yeah, and the foot actually moves lateral.
Oh.
I just meant it's just kind of a weird trick on your brain. Okay, really well done. Miss Dowler, again, they're talking about the hip here in 57, not the bent knee here. What is this hip doing?
Extension.
Thank you, ma'am. All day long, yes. Miss Flores, what movement brought these two legs together?
Abduction.
Adduction, yes. Thank you, thank you. Miss Tops, what kind of rotation of the hip is this that, believe it or not, is bringing the foot medially, but that's not the point. What? Lateral rotation. Thank you so very much. Now we're talking about the knee. Now we've got a dot on the knee, right? Now we've got a little dot on the knee. So, Miss Juntapone, what kind of movement is happening at the knee here?
Friction.
Flexion of the knee. Thank you so much. And Mr. Kachekian, what kind of movement is happening at the knee here in 62? 62.
That is extension?
Yes. Always think about when you're at the gym and you're doing leg extensions. That's how I remember that, because the knees are kind of backwards. Well done. Thank you, thank you. Miss Kilpatrick, what is happening at 64 here? Is this person lifts their toes up, takes the foot off the gas, so to speak. Miss Kilpatrick. Oh,
Dorsey
yeah,
flexion of the ankle.
yeah, that was beautiful. Thank you. Mr. Nochin, what is happening in 65 here? As this foot kind of bends to the side here. Yeah.
Inversion of foot.
Inversion. Really well done, sir. Everybody, if the bottoms of your feet are turning towards each other, you are inverting. If they're looking at each other, you're inverting. If the bottoms are going out and looking away from each other, you're everting. And that's very important. We do care whether people walk on the sides of their feet or the middle of their feet and all that kind of stuff. Really well done. Miss Cuppage, yes, ma'am.
Okay, so I start getting myself confused, and I don't know if anybody else is, but most of the muscles that are on the front are flexing, and most of them are extending on the back.
Yes, but when we get to the feet, it's different, huh?
With the yeah,
And
so
the knee.
last night it was like I was starting to get really confused, and then also with the legs, and I was like, wait, I thought that the ones in the front were the flexors and the ones in the back were the extensors, and then all of a sudden it changed, and I was like, I don't know.
Yeah.
So is it just the
So, can I give you a different definition of flexion and extension? Flexion usually means to close an angle, to make it smaller, and extension usually means to open it up. So, if I close my fingers, I'm making this angle here smaller. That's flexion. Extension usually means opening it up. Or my knee too. If I bend my knee, I'm closing that angle back there, I'm flexing it. So, you're right, it's not always front and back. It's just something we start you out with. I don't know if that helps. But it is confusing.
but the muscles that are in the front of the lower leg,
Are extensors, really. Not all of
the
them, but
ones in the front are the extensors, and the ones in the back are the flexors?
yeah, because they reach underneath your foot to pull the toes down from the back, and that's how they flex the toes, yeah.
And then on the foot, the top ones are the flexors and the bottom ones are the extensors?
No, it'd still be the
top ones
extensors.
are the
Because muscles can only do one thing and pull, and whether they're on top of your leg or on top of the foot, they pull and extend out the toes. Yeah, it is a little confusing. But I'm kind of encouraging you not to memorize it about front or back, because it doesn't stick to it enough. Instead, think about whether things are extending. Are my fingers extending? Or are they flexing? Are my toes extending out? Or are they flexing? If they're extending out, I need stuff on top of the leg, on top of the foot to extend them out. Does that make sense?
One thing that helps me is not separating the lower leg and the feet, just putting it together.
Yes.
All the muscles in the leg goes to the feet. So if you just look at it as one versus separating them,
Yeah.
all the legs in the all the muscles in the back of the legs flex the feet. All the muscles in the front of the legs kind of extends the feet.
and the same within the foot too.
Yes.
The muscles on top
Yes.
of the foot extend,
Yes.
and the muscles on the bottom
Yes.
flex.
And all you really do is you have longer, stronger ones in the leg and smaller, less strong ones in the foot. But you're right. The front of the leg, top of the foot, which is kind of the whole front of the leg foot, extension. The back of the leg, bottom of the foot is all flexion. All.
Okay.
Yeah. Sorry, I know that doesn't completely clear it up, but I think you understand. It's just jarbled in there a little bit.
Yeah.
Good. Thank you, ma'am. All right, we're not going to go
Thanks,
about...
Miss
What?
Thanks, Miss Tops, is what I meant to say, but I muted myself.
Yes, thank you, Miss Tops. All
Okay,
right, we're not going to go over this stuff at all. Or this stuff, or this stuff. Okay. This is a good place to take a break. I'll see you guys back at 10:06. We're not messing around today. Smoke them if you got them. See you in 10 minutes. 1 minute.
minutes goes by like 2 minutes.
Oh, you're telling me. Like,
Do you have a timer back there for you?
I just look at the clock. But I mean, I go back to my office and answer like a really quick email or two, and I'm like, oh gosh, I got to get back. Yeah. And 10 minutes is short, but I feel like we're making really good progress, and I wanted to kind of keep pushing. So, we are still recording. Okay, it's 10:06. So what I've done is you guys do have one homework assignment due tonight. It is, I highly recommend that you do it on a computer or a tablet, not your phone. It's not a hard homework assignment, but it's asking you like, what are the 3 calf muscles, but it gives you a list of like every muscle in the body to pick from. And because we want you to search and find them. It really is helpful. We've had past classes tell me, and I quote, "I hate you, Tapscott. I hated this test, but boy, did it really help me." And ask Ms. Bauer, we actually heard that kind of stuff from multiple students. So it's not hard, but it's hard on a phone if you can't see the whole 50 muscles and such. I've released it now so that while I'm doing review, you can work on it now if you want to. It is worth 90 points. So if any of you are like, oh, my grade could use a little boost, take it. If any of you are like, oh, I don't want my A+ anymore, don't take it. Anyway, it's a good little shot in the arm with 90 points. Okay, let's continue on though. So you're welcome to be working on that, but I am going to be calling on you too. So it's whatever you're into. Okay, let's see. So we're going to talk about bones really quick because bones are really, really important. Yeah? And I was just wondering if this slide really does a good job with that. Anyway, I'm going to ask you questions about bones, and then we'll move on to muscles maybe, or I might just stop at that point and let you guys do some time with your homework without me barking at you. Okay, Miss Flores, can you tell me what number 5, the bones in number 5 are called? They're part of your spine.
Cervical.
Yep, cervical vertebrae. Yep, awesome, awesome, awesome. Miss Tops, what's number 6? What is that bone?
Clavicle?
Yes, ma'am, it's your clavicle. Your collarbone is your clavicle. Miss Juntapone, can you tell me what this, kind of this middle, number 7, this middle chest bone is called?
Sternum.
Sternum. She's exactly right. Cool, cool, cool. Mr. Kachekian, what's number 8 called? Your arm bone here.
That's the humerus.
Humerus. Don't be making any jokes with me. All right. Miss Kilpatrick, what is this bone in your forearm here called that runs to your pinky?
Number 9.
What?
You talking about number 9?
Yeah, number 9. Yes, ma'am. It runs to your pinky.
Number 9.
Starts with a U.
I can't pronounce it. It is U-L-N-A?
Yeah, ulna.
Ulna.
Ulna, good job. Thank you, ma'am. Mr. Nochin, what's this bone here that goes in your forearm that goes to, number 10, goes to your thumb? I'm so sorry. Yeah.
Let's see, the radius?
Yes, sir. Thank you, sir. Miss Langford, what are these bones called here in your wrist? Number 11.
Carpals.
Yeah, your carpals. Really well done. Thank you, ma'am. Miss Cuppage, what do you call these bones after the carpals? I'm calling on you because you actually said it earlier for something else.
Those are the metacarpals.
Those are the metacarpals. Thank you very much.
I have a question, though. And I have a question. I'm the question girl.
I have a question. I have a question. Yes, ma'am. What's your question?
I just went to start to take the quiz, and it says the three muscles, and it tells what they are.
Yeah.
And then it has the whole long list.
Uh-huh.
And I go to click on something, and it won't click.
It won't click.
It won't light up.
I'm having the same problem.
Really?
And it just kicked me out of the quiz, yeah.
Me too.
Oh.
It just closed the quiz for me.
It just did
Same
what?
here.
Wait, it just did what for the
Okay.
quiz for you? Mr.
Just like to speak for all of us, it's not working.
Okay, but Mr. McClure, you said it. Did it post the quiz too? Did it kick you out and then post?
No, it was posted, but then it logged me out. Basically, Canvas kicked me out.
Yeah, hold on. I'm going to look at it on my end. I'm assuming, by the way, it's a problem with our server on our end.
Cap Scott's trying to fail us all.
Yeah.
Right?
Ha ha.
Good luck taking a 90-point quiz. Good luck.
I've really enjoyed my time with you guys. I thought, how can I extend it? And there's only one way to extend my time with you.
We get it.
Actually, by the way, it's frozen on my end, so I'll look at it in just a minute. I'm going to wait. It's still frozen on my end, which suggests that it's having problems. Okay. I'll come back to it in just a second. What?
I think it's all of Canvas.
Yeah, it's all good.
They're not muted.
Hold on. Yeah, there's a whole bunch of people unmuted here. Here we go. All right. There we go. Okay. So I'll check it in a second, but it's all of Canvas. Yes, I can't get into Canvas right now. So sorry.
I think it's having issues.
I think it is having issues. Yes. Yeah. And we'll be a little bit patient with that. If, by the way, if it continues to have issues, what I'll do is I'll extend the due date on this thing. So it's due tomorrow morning right now.
What are you going to do it for us?
Oh, Ms. Ramirez, I would, but I'm already amazing at my anatomy. I don't need to do it.
I know.
If it continues to get problems, I will extend it till Monday. So, even if it just even gives me problems till 11 o'clock here, we'll go till that time. Okay. So, where was I? This really threw me off. Okay, Miss Lopez Moreno, what's number 13? What are those bones called? You got 14 of them. Number 13, but you got 14 of them.
Those are the phalanges.
Those are the phalanges. Yeah, absolutely. And by the way, so is 16. Everybody down here, your toes and your fingers are made up of the same bones called the phalanges. Just so we all know. Mr. McClure, it's really hard to see, but what is 17? It's really pointing to this bone that really is your backside, but you can see a little bit from the front side here.
Scapula?
Yeah, that's your scapula. Thank you, sir. What is 18, Miss Magruder?
18 is the
Yes, don't overthink it.
ribs, thoracic.
Yeah, the ribs. Those are the ribs. Cool. Miss Mitchell, what's 19?
Is that like the vertebrae?
It is the vertebrae, and they're really picky, though. They want to know which vertebrae. And I don't mean the lumbar vertebrae, yes. The lower vertebrae. Awesome. Really well done. Mr. Benrod, what's number 20? They mean the whole thing.
Yeah.
It is the iliac. By the way, that is the ilium, and this is the iliac crest. But they're referring to the whole thing as the pelvis. I actually like your answer better. In the anatomy world, we'd talk about what part this is, and that's the iliac. Well done. Miss Ramirez, we don't normally see it from this side, but what is number 21? What is this upside down triangle right here?
The sacrum?
The sacrum, yes, ma'am. Miss Ratana, what is number 22? This little tailbone. It's your tailbone, actually. We don't talk about it. Coccyx. It's hard to say. Coccyx, and you did great. Thank you. Miss Smith, what's this big bone right here?
Your femur.
It is your femur, yes. Miss Kilpatrick, what's this bone? I know you know it. What's this bone here that's your kneecap?
The toe?
Yes, ma'am. Thank you. Miss Stewart, what is the medial thick bone in your leg? Medial thick bone number 25 in your leg.
The tibia?
Yes. Sorry, I made that funny face because I got confused for a second. It's 100% your tibia. Because the skinny lateral bone is your fibula. Really
Yeah.
nicely done. All right, we're moving along from that. We are not going to go through the whole backside then, too. We're not doing types of joints. We are not doing that. All right. Can you guys get into Canvas still or not? We haven't gotten there yet. There we go. Can you guys get into Canvas yet? Now you can, Miss Mitchell? Yeah. No? Some of you can? No? Not you, Mr. McClure?
Still frozen. It still won't let. Like I'm in it, but it won't let me click on anything still.
Yeah, let me see what I got here too. Have you refreshed it all? That's a lot to ask.
No, I'm trying now, but it's like frozen. Let me see.
Mine's frozen too. It won't refresh.
Well, that little stinker. All right. Well, tell you what we're going to do right now.
Mine's working. It's just a little delayed.
Yeah.
Mine's thinking. And just a reminder to everybody, get your fingernails ready for tomorrow.
Yes, by the way, honestly, that's super important. All right, just to be extra fair. Don't care about that. I'm changing the due date on this to Monday.
Thank you.
So, well, I'm hoping you don't have to waste your weekend doing it. I'm hoping you can kind of get to it sooner. But yeah, it did not work out the way we intended, and I think we have to compensate for that. So I just reset the due date to Monday morning, just kind of like a weekend thing. And you guys will have homework tomorrow, but remember, all it is what did I learn today? A little 5-point exercise you get right at the end of every day for clinic. All right. So anyway, I hope that helps a little bit. Maybe we should stop right there and let you guys work on this now. Yeah? We've seen some of these muscles that are coming up right now already, and we will see them again. But I feel like we got through a lot of the